Welcome to another surgery. We have Mr. Eggplant here, who's endured some type of injury right down here. So, we're gonna go in and see if there's any additional damage that was done, and we're gonna fix it. Now, let's get started here. Just gonna set out some tools I might use. Next, we're gonna clean the area that we'll be working in. Now just kind of let that dry. It doesn't have to dry all the way, but as much as we can get it to dry. Okay, let's begin. Gonna make an incision around this damaged area. Now I'm gonna take this tool, kind of free up some more of that tissue. So that we can lift it up. Just doing all right up there. Just breathing fine. Okay. Grab my forceps and start lifting some of this tissue. It's really tough tissue. Now I'm gonna take this tool here and kind of undermine there and try to free up more so I can lift it. And I can kind of feel how far I'm going because I do not want to damage any internal organs when I'm doing this. And it's all based on feel. Just trying to get through the fat and muscle and stop right before the organs. Okay, let's try lifting that one more time. Still pretty stuck there, but not as much, definitely. Oh. As we can see there, this is blood clots. And this is probably due to all the internal bleeding going on, which we're about to see. Yes, like I guessed, there would be a lot of internal bleeding. This is tough because we don't know where he's bleeding from. Well, we're gonna try to find out. I'm gonna set that tissue there. We're still in the fat layer. As we can see, we have lots and lots of blood clots going on, which is not good. Mr. Eggplant wouldn't have came in sooner. The blood clots would have clogged his arteries and vessels, and he probably would have died. Bleeding is coming from somewhere deep inside the... Well, we'll keep working away here. Removing more tissue. I do see something there. It looks like a kidney. And the kidney is yellow because it's surrounded by fat. It does have some blood stemming from the back artery of the kidney, which I think is our bleeding source. So I'm really glad we found that. But let's peel away some of this fat. So we could take a look at the kidney and see if it's healthy. Got a nice chunk of fat off of there. Kidney looks healthy so far. But we'll have to unpeel it all to know for sure. Just peel the fat away with my hands. So far the kidney looks great. It's a little discolored right there, but that's normal. That comes with age. Mr. Eggplant is 64, so that's normal for his age. But now that we've freed up that kidney, we can place it back inside. We got the bleeder taken out right there. So we can place it back inside Mr. Eggplant. I'm still gonna keep looking for more bleeding because his accident was very serious. He was skiing and crashed into a tree full force, going 65 miles an hour. That's why he has so much blood clots. They still keep coming out. So I'm going to resect just a little bit more. I'm going to use my scissors to cut some fat away. No bleeding yet. still lots of blood clots, as we can see. And over time, they'll just disintegrate back into the blood system through phagocytosis. That's what it's called. I see the other kidney. It's way in the back, but it does not look like it's bleeding at all, which is good. So we'll take it out and examine it. It looks okay. Oh, there's a blood clot stuck to it. I will not take the fat off of this one because it's not bleeding. There's no need to find the bleeder. That's the main reason I took the fat off the other one. So we'll place this back inside. It's normal for the kidneys to have fat around them. Place that back inside. And I don't see any more bleeding. So just a piece of fat. So next I'm just gonna inject some sodium chloride into Mr. Eggplant's abdominal cavity. This will just help with his electrolytes, which can be out of whack after a big surgery like this. We'll just kind of inject that all over. Then we'll just clean him up a little bit. And then whatever healthy fat tissue we'll have, we'll place it back. We'll get ready to close. So we'll put this back on. Oh, I forgot to put in a drain. And we'll put this drain in so that any extra fluid that collects in there will have a way to get out. If the nurses can empty that, I'm going to make a hole to the outside. And I'm just kind of poking a hole here because that's where the drain will come out of. Then I'll take this drain here, thread it through there. It's hard to get these in, but that's why they work so effectively. There's our drain. So I'll hold on to the drain and pull it. I'll just keep this inside here. That's how all the fluid will get out. And we'll hook up this to suction. Once he gets to his room, we'll place that back on. And we'll wrap his incision site. We kind of need a bigger piece because it doesn't fit all the way around like I thought it would. We'll take another piece. This will keep the incision site nice and compressed, give it time to heal. And we have our drain here sticking out the bottom so that we can get access to it and hook it up to the suction. And now we can go tell Mr. Eggplant's family that his surgery was successful. He will have a speedy recovery. We found our bleeding kidney and our blood clots, which will go away on their own. And he should be healed in about 2 weeks.